Hello everyone and welcome. My name is Barb Cochran and I'm the director of the Tournier Center for Healthy Aging here in the School of Nursing, and as usual representing the Northwest Geriatrics Workforce Enhancement Center, which is sponsoring this lecture series. We are in, I think, the third to the last lecture in the series for this year, but we will be offering it again next winter and spring, so stay tuned for that. I'm very happy today to introduce Gail Anderson. She is a professor in the School of Pharmacy at UW in Seattle. She's been an investigator on numerous federal and industry-funded research grants, including studies on natural products, and she's an author of over 100 peer-reviewed publications and chapters. She teaches clinical that's why I don't take that class. Pharmacokinetics, and offers an online course on natural products to students in health sciences. And Gail is going to talk to us today about herbals, supplements, and dementia. Welcome.
Okay, thank you. So I'll be talking today about 4 different products: ginkgo, the omega-3 fatty acids, antioxidants, and Huperzine A. And the reason for looking at these particular compounds is there is a relationship between nutrient deficiency and dementia onset, and there is evidence to suggest that antioxidants and omega-3 fatty acids may be neuroprotective. And then for ginkgo, both ginkgo and Huperzine A have a long history of use in China for the treatment of cognitive disorders and memory. So that's the kind of the reason why we're looking at these 4 compounds. So to start with ginkgo, as I said, it's used in traditional Chinese medicine for actually thousands of years. It's only been used in Western medicine since 1960. And we actually have a beautiful ginkgo tree here on campus. It's a very beautiful tree, and pretty much all of the parts of the tree, well, the leaves, the fruits, and the seeds are all used for medicinal purposes. So from a pharmacology standpoint, when you're looking at kind of cell culture studies and animal studies, it really looks like a compound that you would expect to have kind of neuroprotectant kind of properties. It has both antioxidant and anti-inflammatory properties. It's a free radical scavenger. It's been shown in vitro cultures to be an anti-amyloid as far as forming amyloid, and also an anti-platelet activation factor. And a lot of these studies were really done after some small clinical trials showing what appeared to be an effective compound in Alzheimer's and dementia as far as protecting and helping cognition. So there's actually a lot of literature on ginkgo. And for general pharmacology, when you're looking at kind of more in vivo animals, it lowers blood pressure primarily by causing vasodilation. It seems to increase capillary flow and decrease blood viscosity, which technically would help as far as increasing blood flow to the brain, increase nitric oxide. So pretty much all of these things kind of look like a compound that would have neuroprotective effect and actually also modulate neurotransmitters in these animal and in vitro studies. So like I say, there was just a lot of excitement about ginkgo. So almost all of the studies, which is very unusual with natural products, almost all of the studies have actually been done using a very well studied and very well standardized extract prep of the ginkgo leaf. This is the EGB 761, and pretty much the majority of the published work has really been done with this one standardized preparation, which makes it very nice as far as evaluating the literature. For almost all the other natural products we're looking at, we really do not have standardized products, which adds one more variable. But in this case, we have a very good standardized preparation. And the manufacturer is from Germany. So after all that hype on saying, wow, this looks like this is just going to be great, there actually have been over 30 double-blind trials published. and on ginkgo, and most of the earlier and the smaller studies showed that ginkgo was more efficacious than placebo in the treatment of dementia and in Alzheimer's disease. And then there were two very large multi-center placebo-controlled studies that we're going to talk about right now in the US and one in France that found actually no preventative effect, which is kind of a bummer and really not what really people expected. So the first one was done here in the US. It's the GEM study, and it was done in 5 academic medical centers and over 3,000 subjects greater than 75 years of age. 2,500 of them or so had a normal cognition at the start of the study, and 482 had some kind of mild cognitive impairment. They all received kind of a standardized dose of ginkgo, actually using this EGP 761 extract that had been shown in these smaller studies to actually have a positive effect. So it was 120 milligrams twice daily or placebo. And the primary outcome was the incidence of dementia or Alzheimer's disease as evaluated every 6 months. And this is the results. And basically, as you can see, the 2 lines there, this is looking at a cumulative, I can't read it from here. Usually I have this on my, can I stand up and look at this, you guys? Is it all right to do that? Or is that going to mess up your mics? So this is the cumulative dementia rate. So that was going to be my guess. That's what I thought it was. And as you can see, as you increase the amount of dementia, it was exactly the same between placebo and ginkgo. So it was really not effective at all in reducing the incidence rate of dementia or Alzheimer's disease. But what was a little concerning, in the side effect profile, there had been actually case reports of bleeds in patients taking ginkgo. And in the large study, there were twice as many patients that ended up with a hemorrhagic stroke than those who were on placebo. And so this was, even though it was not statistically significant, it obviously raised some concerns. So a lot of the thought up to this point was, well, there are studies showing it may be effective. It's pretty innocuous. If people want to use it, that's fine. But this suggests maybe there might be some serious adverse events, even though rare. So they also looked at the kind of rate of change over time in the cognitive decline in older adults in this study as a kind of another analysis. And so when they did that, seeing if even though the actual incidence was no difference between placebo and ginkgo, was the rate of change in this cognitive decline any different when they started with really mild impairment and not Alzheimer's disease. And indeed, it did not. It did not have any effect at all in altering cognitive decline in the adults who had normal cognition or mild impairment. So 2 negative outcomes on the US study. And then a later study was completed in France, and this was done in 2,800 adults over 60 who just had self-reported memory complaints. So they didn't have patients actually with Alzheimer's yet in this particular trial. So again, it was the same standardized dose of ginkgo that had been shown to be effective in the smaller trials, or the matched placebo, and the primary outcome was the diagnosis of Alzheimer's disease. And the results of the study was exactly the same as the GEM study. There was the long-term use of the standard ginkgo did not reduce the progression of Alzheimer's disease in patients who had just initial memory complaints. The good thing is they ended up with no increased risk of hemorrhagic stroke in this study, not even a clinically or statistically non-significant effect. They didn't really see the increased risk. So that was, I think, people felt a little more comfortable with that. So Cochrane, you may have heard about Cochrane analysis in this group before. They do systematic reviews of topics, and in 2009 they did a review of looking at ginkgo for cognitive impairment and dementia, and they basically used a variety of strengths and durations of treatment, and the patients could have any kind of cognitive impairment of any basically severity. So they looked at all of them. They had 36 trials, but most were pretty small and less than 3 months. But 9 trials were 6 months of duration, or at least 6 months of duration. And most used the standardized form of ginkgo, but at different doses. And the results of the analysis was similar to what we found in the big double-blinded studies, basically inconsistent results for effects on cognition, activities of daily living, mood, depression, and caregiver burden. Interestingly, of the 4 most recent studies, they were all the longer and of adequate size, so they were powered well. 3 found no different. I showed you the 2. But 1 actually reported a very large treatment effect. And this was a study done in the Ukraine, and they had about 400 subjects, but they all had Alzheimer's with neuropsychiatric symptoms. And they found a significant effect. So we'll come back to that in a minute, as far as maybe that has some meaning. And then they also did a sub-analysis of those patients who actually had Alzheimer's disease to see if there was any kind of effect, and felt that there was really no benefit compared to placebo, especially when someone has Alzheimer's. So this issue about whether or not there's a subset of patients that might benefit from ginkgo was also looked at in this more recent study in 2012, and this was done in Germany, and this also had over 400 patients, and they had mild to moderate dementia, but they had neuropsych features with their early dementia. And they used the same ginkgo, except they used 240 milligrams once daily. And their primary outcome was the SKT, which is a cognitive test that is available in a large number of languages. And it uses pictures instead of words, and a lot of people kind of prefer it as far as being a little bit more generalizable. And then they did neuropsych inventory. And again, I just need to note here, this was funded by the company who makes a ginkgo, which has been kind of an issue all along. Just that I always hate to just say that, because the people are willing to fund these studies too. So you hate to see it always just as a negative. So if you look at the data on the slide, just glancing at it, you can see that in this patient population of 400 patients with these neuropsych symptoms, they had a significant effect, and not only on the neuropsych features, which was true of the first study in Ukraine, but also on cognition. So they found basically they felt clinically relevant improvement in cognition, psychopathology, functional measures, and quality of life in patients and caregivers. So it really kind of lends yourself to think, well, maybe we should be looking at, maybe not just lumping all the patients together. Maybe there are a subset of patients that can benefit from ginkgo. So in summary, there's really a lack of evidence demonstrating a benefit in large studies with just general dementia and Alzheimer's disease. I like this quote because after the latest study came out in France, and there was an editorial on the study, and if ginkgo were a drug and not marketed as a food supplement, clinical testing for efficacy against Alzheimer's disease and cognitive impairment would have ended long ago. So I think really the thought is there's a lot of believers out there still. And in spite of these very large studies, I think we will continue to see studies on ginkgo. And maybe there is a role for ginkgo in a specific subset of patients, maybe with dementia with the neuropsych features. Safety was overall good, except these reports of kind of rare bleeding. And so as far as drug interactions, you really should probably use ginkgo cautiously or avoid it in patients receiving anti-platelet drugs, like your aspirin and your Plavix type of drugs, or anticoagulants like warfarin. And a new study just came out saying that we probably have a right to be concerned, at least with warfarin. This was a study done in the VA, and they looked at people who were receiving ginkgo along with warfarin versus those on warfarin alone, and found a significant increased risk of GI bleeds and intracranial bleeds in this database study. So it does suggest that if people are taking ginkgo, to make sure they're not taking anticoagulants or antiplatelets. And so this is just a couple of products. These are Nature Way, just to tell you that Nature Way is one of these, it's the EGB product, and it's definitely the best and almost nowadays almost only studied product. But what's really nice about the Nature Way, they actually go through USP certification, so you know that whatever herbal you're looking at, that the companies have agreed to be have their products evaluated or manufacturing evaluated to make sure they don't have trace metals in them and that type of thing. So if you are going to use a supplement, look for those USP standards on there. So can I ask if there's any questions on ginkgo before I go on?
Most of what we've gotten so far are just AV kinds of issues, but are there questions in the room?
It's not a question, it's more a comment. I have a client who is mentioned about ginkgo biloba, and I say, what is that? I never hear that. So it was a surprise to me because he believed it can help to remember things because he started to forget about things and getting lost. So, and he feel like it's beneficial. Even when I say we don't have some medication where it can help you, so maybe in other activities, just a routine, but he believed that's the thing where he's not gonna give up.
Right.
So
the comment was that people are, to summarize, are true believers. And I think one of the things that's haunting a lot of the studies that are being done with natural products, I think the classic example of that is St. John's wort, where the placebo arm of the study comparing St. John's wort to sertraline to placebo, you had a tremendous placebo response. So people who do actually get involved in these studies are true believers. And I'm actually a big believer in placebo. If a placebo works, I have no problem with that. And so you like to think some of these have benefits too. And clearly the in vitro and animal studies and everything they've done says these compounds that are in ginkgo, in the extract, very likely should be able to have some effect. But it maybe we just need to maybe select our populations better. So, but yeah, the placebo effect is wonderful. As long as it's not, as long as the patient is not choosing a natural product instead of a drug they should be on, and it's not breaking the bank, and it doesn't have, you know, serious tolerability issues. So I mean, there are things that people should not be taking. So good point. Okay, so the next is fish oil. And obviously, we all know the many health benefits of eating fatty fish. It's very well established, and the data, primarily with cardiovascular health, is pretty robust. And actually, people taking omega-3 fish oils is actually the top natural product used by adults right now. But there's also very, very good evidence when you're looking at cardiovascular disease that eating fatty fish is not the same thing as taking a supplement. And with the thought that when people are eating fatty fish, they're not eating other things. And if your lifestyle is probably different. So if you're just taking a supplement and not changing anything else in your life, it doesn't seem to have the same effect as actually eating fatty fish. And it looks like we may have some of those issues also here with Alzheimer's, we'll talk about here. So what is fish oil? Well, it usually contains about 30% of the omega-3 fatty acids. These are essential unsaturated fatty acids, and they're vital to normal metabolism. And they cannot be synthesized by the normal body, so you have to ingest them. EPA and DHA are the most prevalent, and their highest amounts are in oily fish. These are your mackerel, trout, salmon, herring, and sardines. And I know this is primarily a figure for looking at the effects on cardiac, but the pharmacology is the same as far as if we're looking at it as a neuroprotectant for the brain, in that it has the omega-3 fatty acids have big effects on triglycerides. They lower triglycerides. In fact, there's a prescription product, high dose of DHA and EPA that is used to prescribe for treating high triglycerides. Clearly decreases inflammation and is good for endothelial function, affects platelet aggregation, and pretty much all looks like it stabilizes plaque and therefore causes cardiovascular protection. And you can really kind of transfer this and say, okay, what's happening to the brain? And you can see these same type of processes would also be good for brain health. So if you actually look at the membrane, the neuronal membrane, it actually contains primarily DHA, and which is the most common fatty acid in the brain. And DHA is actually involved in a large number of processes that are involved in maintenance of a healthy brain, neurogenesis, neuronal differentiation, etc. And we also know that if you look at normal aging and people who have neurodegenerative diseases like Alzheimer's, that this cognitive decline is really correlated with a deficiency of DHA in the blood in the brain. What we don't know is what is the cause versus the consequence. Is having DHA affecting cognition, or do you have the cognitive decline and what's happening in the brain decreasing DHA? So the issue of just eating fish, has been looked at as far as Alzheimer's and incidence of Alzheimer's. And so this is a study of a large number, 181,000 subjects, and they followed them anywhere from 2 to 21 years. And they basically had people self-report their diet. And what they found is that at least 1 serving per week of dietary fish is associated with a 5% lower risk of dementia and a 7% lower risk of Alzheimer's disease. If you then separate out the kind of fish, if they're just eating white fish, they're not getting a lot of DHA and EPA. So if you're looking at the amount of the fish that is actually, your DHA, then just 0.1 gram per day of this dietary DHA was associated with a 14% lower risk of dementia and a 37% lower risk of AD. So clearly there seems to be very large effects on these observational studies as far as just eating fish. And they did some mathematical modeling and showed kind of this curvilinear relationship between how much fish people took in and how much DHA, et cetera, and the risk of Alzheimer's disease and mild cognitive impairment. So this was kind of some of the early evidence suggesting that we, really should be considering fish supplement or omega-3 supplementation for Alzheimer's. So this was a study, I realize I didn't put the numbers on here, it's about 400 some patients where they treated them with 900 milligrams per day of DHA or placebo, and this was a 24-week, 6-month study. And these patients basically had just mild age-related cognitive declines, so they didn't have Alzheimer's disease. And they found that the supplement improved both learning and memory in these patients with age-related cognitive decline. And that was their summary. But if you look at kind of the scatter plot that came out of this study, there's your statistical significance, but this to me really looked like a kind of a amazing scatter plot. You can get your statistics out of here and say that, yeah, as you increased your plasma levels, you improve your memory scores. But it's pretty kind of, I think, kind of iffy data. But the trend is there. So, another study looked at, and it's actually rare that they were just looking at DHA. Most studies have really looked at the combination of DHA and EPA. And this study just came out. It's 2017. But they were looking at 4 parallel groups, and they divided them into those who received your omega-3 supplements, those who had some type of multi-domain intervention, which was a combination of cognitive stimulation, physical activity, and nutrition, the combination of the supplement with their intervention, and then placebo with their 4 arms. And what they found is they found no significant effect of either the supplement or the intervention on cognitive decline in these patients who just had basically memory complaints. So again, one of these Cochrane analysis, they kind of summarized 3 studies and showed that kind of using a wide range of supplements, there seemed to be no significant effect with the supplements on cognition, dementia, quality of life, or mental health at 6 months. Which is kind of, again, too bad. So now we get back to maybe, are we looking maybe at different populations? In this case, we're looking at maybe what people's baseline levels of the omega-3s are. So this was an analysis that was a subgroup of patients that were part of another study where they're looking at combination of omega-3s as well as vitamin A and vitamin D. And they actually looked at the relationship between actually plasma concentrations. So your actual, what are people getting when they take that supplement on cognition. And they actually found a kind of a dose-response relationship where the higher the levels of the omega-3, the better the effect on preservation of cognition in these patients with mild cognitive dysfunction. They found, which I teach pharmacokinetics, which is what the body does to drugs, and I teach effective sex on PK, and one of the primary things I tell my students is size matters. And usually it's in the case of the fact that women have higher adverse drug reactions because they often get the same milligram dose of a drug, and a lot of women are much smaller. So they automatically have higher exposure. I mean, there's a lot of reasons why people have adverse drug reactions, but one of them was the size matters. Well, in this case, size matters in that females actually had higher levels of the omega-3, which is what you actually wanted. And so they were suggesting that if you actually adjust for body weight, this effect went away. And they said that really future studies really need to adjust doses based on body weight to make sure people are getting adequate doses. And I will also throw in there, they also need to look at what the baseline level is to start with. So this is, again, another, what I think is kind of a scatter plot, but it has a tendency to go down. So as you increased your concentration of your DHA, you did see some improvement in cognition. So suggesting that dosing may not have been properly done in some of the studies. And then I think this was really kind of a real interesting analysis. So this was also part of another failed study. You're going to get the message of this talk, unfortunately, failed studies. But this was a study of vitamin B complexes in mild cognitive impairment, which failed, and they did not find an effect of the vitamin Bs. But they decided to look at, in these patients, because they had plasma, they measured what their omega-3 plasma concentrations were in these different patient populations. And when they divided up the effect on their scale, so higher is better as far as affecting cognitive decline in this chart. So if you look at the placebo is the open bars, the black is the closed bars, that as you increase the amount of omega-3, so the quartile basically would mean those with the highest quarter, actually be the highest third in this case, of omega-3 plasma concentrations actually had an effect from the vitamin B. So it's complexes. So it suggested that you may have some interaction there. So in summary, I think higher fish and fish oil intake has been linked to the decreasing risk of developing Alzheimer's disease in these population observational studies. However, treatment with the omega-3 supplements seem to have no effect on cognitive function overall. And there is, in patients with Alzheimer's, and there's kind of conflicting data as to whether or not they're effective in age-related cognitive decline. So adverse events, have any of you guys tried to take fish oil? It makes people burp, and they smell sometimes. So it's not necessarily the easiest supplement to take. I've been told if you keep your fish oil supplements in the freezer, that it helps with all that. But the one issue is you have to make sure you have a good product, because if you have, you can have mercury contamination depending on where they get the product. Most products don't have that. The one concern is there's a study called the SELECT study where they measured omega-3 concentrations, and it was in men, and what they found is those men that had the highest concentrations of omega-3 had an increased risk of prostate cancer. And there's actually, this goes along with some case reports in other studies of prostate cancer. So that's kind of an unknown at this point, but something to keep in mind. So it's safe, except for the fact that we don't know very much about this issue of prostate cancer. In very high doses, there have been reports of increased risk of bleeding, again. And so, again, you probably want to use fish oil supplements cautiously if your patients are taking warfarin or anti-platelet drugs. And there's just so many unresolved efficacy issues with fish oil. I mean, there's just, what is the optimal dose? I mean, do you need to just eat fish? Or, how much of the DHA, EPA? What is the ratio of DHA to EPA we need? For instance, one of the prostate cancer studies suggested that the DHA might actually be protective, and it might be the EPA that's the problem. So there's, these things that need to be looked at, and just the role of the omega-3 to omega-6, which is a very big issue in the U.S. diet, and what is the duration of a supplement? So still a lot of unknowns. And these are just some fish oil supplements. So should I stop and ask for any questions on omega-3s?
So someone is asking if ginkgo would be used at an earlier age as preventative.
So the question is whether or not ginkgo should be used at an earlier age as preventative. I think the studies have been, fairly clear that is not shown to be effective. So the patients they were including in these trials had a fraction of that just had age-related cognitive effects. And I guess it depends on what your definition of age-related. So there are not studies starting ginkgo in someone in their 30s, for instance, and to see if there's any effect. But I mean, that's a very good question. And that goes along with the other things that other people feel we should all put our statin and a little bit of aspirin, and in some cases an SSRI, and a little ginkgo in all our water from the time we're 40 on. And So, unfortunately, that's going to be just an impossible study to try and do, I think, because your outcome measure of, onset of Alzheimer's or dementia, you'd have to start with millions of subjects in order. And NIH and other people like to fund 3 and 5 year studies and not necessarily decade, 20, 30-year studies. And that's probably what it needs. But it is a very good question.
So someone from Wolf Point is saying that they used ginkgo on their mother. Let's see, just lost it here. When her dementia was already significant, and they observed no worsening of her cognitive skills for 18 months before the disease process started continuing on. It gave me an extra 1.5 years of actually having her with me.
So one of the questions wasn't a really question, it was just someone who had a case, a mother, who took ginkgo and it seemed to kind of stall the cognitive decline. So, those are the case reports, and these small studies showed those things, but the large, well-controlled study didn't confirm them. So that's just kind of the problem here.
And could diet have an effect on the efficacy of ginkgo?
No information on whether or not diet has an effect on ginkgo. There's no studies that have done that or looked at that.
And so then we're looking at fish oils. Somebody is asking, is chai similar to fish oil since it's high in omega-3? Which I didn't know.
I like chai. I didn't know chai was high in omega-3, so I haven't seen anything about that. It's definitely not something I've looked at as far as studies, but that's an interesting issue. I'll have to look into that.
And then this, a little advertised fact is that grass-fattened beef is an excellent source of omega oils. It is the grain they receive that negates the health effects. Right. The whole issue as far as if you're going to eat beef, eat grass-fed beef, because therefore your ratio of your omega-3s to your omega-6 are in a better ratio. So that's true. Is that it? Yep.
Okay. So let's go on and talk about antioxidants. So I'm kind of lumping together vitamin E and C because these studies mostly kind of looked at vitamin E plus or minus vitamin C. So clearly in models, oxidative stress seems to play a role in Alzheimer's disease. And use of antioxidants has been suggested as a preventative measure. So as you know, vitamin E is a family of 8 different fat-soluble compounds. And we actually only have one biologically important form available that we can take as a supplement. And so all the studies have been done with that form of vitamin E. And vitamin C is ascorbic acid, which is water soluble, but it is a coenzyme and electron donor involved in the formation of collagen, muscle, and blood vessel, and also is an antioxidant. So we might as well get to the bottom line here. Several large randomized control trials have found that supplementation with vitamin E, with or without C, does not maintain cognitive performance in cognitively intact individuals, nor does it delay the onset of Alzheimer's in patients with mild cognitive impairment. And observational studies have found conflicting results. So there's kind of been, I think, kind of 3 major observational studies. One done here with Dr. Gray and Larson and using the group health database, where they showed that vitamin C and vitamin E in combination or alone had no effect at all on the risk of dementia or Alzheimer's disease. There was a study done just came out, actually done in Canada, where that's the middle study here, where they found that both E and C supplements in an observational study seem to prevent cognitive decline. And then the bottom study there was done in Utah in a much younger age group, and they found that the vitamins C plus E appeared to decrease the risk of Alzheimer's disease, but neither supplement alone. So the observational studies have been conflicting. The supplement studies have all been uniformly negative. And these are actually some of the supplement studies. A lot of them have looked at combinations. They've looked at comparing, what other medications they're on, with other medications, but pretty much all of them have actually been just totally negative. But we do, and so actually a Cochrane review was done again, and again they just concluded that vitamin E did not alter any kind of progression from mild cognitive impairment and dementia to Alzheimer's disease when you look at up to 36 months. So they had 304 patients with Alzheimer's disease, and then they had 516 with mild cognitive impairment. The vitamin E did not seem to have any positive effects as a supplement. So just this month, I think it was this month, the British Association of Psychopharmacology, in their evidence-based guidelines, they come up and say there's type 1 evidence, basically the best evidence ever, that vitamin E is not effective in reducing the risk of Alzheimer's disease and mild cognitive impairment. But then this was kind of a really kind of interesting study. So this is, again, looking at something different. So all the other antioxidant studies have really looked at effect on cognition. And this was a study, this was a VA study, and they actually looked at, well, they compared vitamin E to memantine to the combination to placebo and looked at functional decline. So not just cognition, but just how the patients with Alzheimer's disease functioned. Did it change anything? And they found a significant effect of vitamin E, but at a high dose. They actually used 2,000 international units a day, had a slower functional decline than placebo. They said the delay in clinical progression was almost 20% per year if they took vitamin E, and that the caregiver time was increased the least in the vitamin E group. The vitamin E plus memantine had no effect whatsoever. So it was just the vitamin E alone. But, you know, the N's are pretty small, you know, just 152 approximately in each arm, and they looked at it over about 2 to 3 years. But still, it suggests that all these other studies have looked at very specific cognitive markers, and this is suggesting that maybe we should be looking at functional decline. Safety, though, high-dose vitamin E has been shown to increase all-cause mortality. This was a meta-analysis where they looked at 10 different studies and took all their safety data and found that if you use vitamin E greater than 400 international units, you increased all-cause mortality. The VA study did not, even though they used the 2,000 international units, did not find that. But then it was a pretty short-term study, too, and maybe the N was too small to really find it. So that is something, obviously, to keep in mind also. Okay. Good news, bad news. So I just threw up Sovinite. I hadn't really put this on the list and decided to kind of mention it because this was someone's idea, faculty from MIT, looked at all the different preclinical data out there, all the mechanistic studies that people were doing in Alzheimer's, and said, you know, what kind of supplemental mix would be the best to slow down and work in Alzheimer's? So they added some, you know, omega-3 fatty acids, they added some choline, they added some antioxidants, some folic acid, all together. And there have actually been 3 randomized placebo-controlled trials, and they, unfortunately, were all negative. So I'd like to leave you a little bit more of a possible positive note. So Huperzine A is an interesting compound. This is an alkaloid, as I said, for hundreds of years used in Chinese medicine to improve cognition and memory. And it's marketed as a dietary supplement to enhance memory. And it's actually a naturally occurring acetylcholinesterase inhibitor. And it's been shown to increase acetylcholine levels in the synapse and the peripheral tissues. And it's actually a more potent inhibitor than our marketed drugs that are inhibitors. It also increases GABA signaling and seems to decrease seizure susceptibility. So there's actually a company now that is developing it as an anti-seizure drug for 2 different types of seizure disorders that are very difficult to treat, the Dravet syndrome and the refractory complex partial seizures. And they're developing actually an extended release formulation, because it turns out your body eliminates this very, very fast. And so that's something to keep in mind when we talk about the studies that have been in Alzheimer's. It could be that the formulation wasn't optimized. So there have been analysis. There's actually been 8 studies in Alzheimer's patients with Huperzine, and 2 studies in vascular dementia patients. And the results of the meta-analysis has showed that it actually caused a significant improvement in the mini-mental state exam, the MMSE, and the activities of daily living score. And that's just to show this here. You can see for all the studies, basically, they all showed an effect, which is kind of unusual for meta-analysis. Usually you're doing a meta-analysis because the studies were too small to show a significant effect. And basically, they all pretty much were all in the positive direction of both the activities as well as your cognition. So, in summary, I had actually, when I submitted this to you guys, there was supposedly a phase 2 clinical trial in the U.S. I looked on the clinical trials database today, and it turns out there is not one in Alzheimer's in this country anymore. There is one in traumatic brain injury, there's one in schizophrenia, one in cocaine addiction with Huperzine, but there is a phase 3 trial underway in China. And then again, this company is developing it for seizures too. It seems to be relatively safe, even though to me these side effects looked a little bit concerning. Most of the reviews considered it relatively safe. The one drug interaction is make sure the patients know this is a supplement. People forget about drug interactions, but it is an acetylcholinesterase inhibitor. And you do not want patients who are already taking an acetylcholinesterase inhibitor to take this at the same time, because they will have toxicity issues. And so you can buy this on Amazon. So here's some Consumer Lab approved products. So Consumer Lab has actually approved some products, so you know for something that is clearly more drug than supplement, it's nice to make sure, again, you have a very standardized, well-controlled product. So I know this wasn't 90 minutes, but I really could not sit here and give you 25 more negative studies just to make this longer. It just would be just so depressing. So my apologies. So, but my conclusion in all of this, though, and being involved in research and also teaching this alternative medicine class, is there are so many unknowns with these supplements. And one of the things I think when you're looking at the antioxidants, for instance, and omega-3s, I think of the study that just came out of China where they looked at using a folic acid supplement to prevent stroke. And it was very effective in patients who had low folic acid levels. And versus when we do these studies, we just treat everybody. And it may be, and therefore it may be diluting your sample out of those people who actually might benefit from the supplements. You also, with natural products like with vitamin D, it actually has a very U-shaped curve so that you have a positive effect at low levels and you end up with a negative effect at high levels. I mean, so you increase your effect to a certain dose range, and then you keep adding doses, and you get a negative effect. And there's more and more studies with vitamin D coming out showing that. We did it with a head trauma model, and the lower doses worked with progesterone, for instance, but didn't work at the higher doses. And so, I mean, I think things that are natural products, we have to think about the fact that more is not always better. I think it kind of seems to be the U.S. way. More dose is better dose. But it actually, in some cases, there's maybe kind of a sweet spot of what we need on these supplements. So, and I mean, at least for the things I talked about today, they were all standardized products. But I have been very frustrated over the 10 years or so that we've been seeing one negative trial after another with ginkgo and St. John's wort and saw palmetto, you name it, and cranberry juice. And part of the issue is we actually do not know, when you're saying a product is standardized, standardized this time. We don't even need active products. I was saying before, you've got your 10 things that are covered in that product. And so maybe just standardizing it on the overlaying with the so it may be that standardized products, but I don't see the NIH wanting to redo these multiple us. I think we needed to do all and figure out first bacteria what was in these natural products, what was self-active. I mean, the ginkgo is your endorsement issue because concentration. This isn't one thing where you need other products, standardized product. So my worry is that have all these trials of these natural products and not knowing what is active. The other issue is how many others that are now living in the world that were negative that were never published. So, you know, that denominator, we just have no idea. I think that's why most people were surprised at the total lack of effect of ginkgo. I do think most people felt there was going to be at least something, that there was enough evidence out there, especially since they're using the same product. So there's just so much unknown with these supplements. And I hope is we just don't give up on them. So, but at this point, you can see why I didn't want to talk till 5:30. So I could have hit you with 20 more negative studies, but I just decided I couldn't do it. So are there any questions? Yes.
Excuse me, I guess your lecture here is basically on natural products only. Now, aren't there also some drug products that are used in the case of Alzheimer's and cognitive problems? And I don't remember the names of them. It seems like there are a couple of them. Imbro is one.
Yeah, I mean, there's. I'm not the one who probably should be talking about just all the pharmacology of the Alzheimer's drugs, but because it's definitely it's not been my research or teaching focus. But most of them have shown a little bit of slowing, from what I understand, and not a lot of big effects.
Yeah, it seems like from what I've read over the years that there's maybe a slowing for a period of time, and then they lose their effect.
Yeah.
And so then that becomes a matter of sort of a strategy of when they get introduced, you know, in a person's cycle or path there. And then you were talking about memantine there at one point, and I kind of missed exactly. Did you say that? I don't exactly know what memantine is, but is memantine
It's a marketed drug, and it had no effect in that study either.
It had no effect. Now, do you know the term galantamine, the drug galantamine?
Sounds familiar, but I'm not positive. So.
Yeah, so.
I think that probably the most depressing thing I've seen in Alzheimer's research lately has been the idea that the drug that would remove tau from the brain or slow the process did nothing. I mean, so you find we've had a biomarker we've been trying to target as far as if we can do this, then it's going to work. It kind of, to me, puts everything back a long way.
Yeah, a couple of years ago there was this big deal about a company down in California, and I can't remember what it's called. I don't remember what the name of it is, but anyway, they had this new drug, and they were just thought that this was going to be the answer. And I haven't really heard much about it in the last year or so, but supposedly there were big studies going on. And so, in your work, I guess you don't really deal with things like that. Is that right?
No, I mean when I see those, because I'm on the clinical trial study section for NINDS, so I see all these studies come through and see the outcome of some of them, and just a lot of the really exciting things that have come through in the 5 years I've been on this study section have not panned out, and it's some of them stopped early. I mean, I think right now, I like I say, I am not an Alzheimer's expert by any means, but it does seem that it's a disease as a whole. They need a restart.
Can you just slightly repeat?
Oh yeah, what we're talking about is what is out there as far as drugs and stuff for Alzheimer's disease. Sorry, I was supposed to repeat the question. And And it's really actually not my field. My research has been in traumatic brain injury, which we also have failed time and time and time and time again. So it seems that at this point, I haven't seen anything just totally really exciting out there. I thought the things to remove tau from the brain were just really, very exciting, especially those patients who had the genetic predisposition to having a lot of tau. And the fact that those studies got closed down really quick really, I think, sets the field back.
So Jeff from Buffalo wants to know, how do ketones affect the brain, and is there new information about ketones helping dementia and Alzheimer's?
Yeah, ketones, the question is, what about ketones and Alzheimer's? I don't know too much. I know ketones and the ketogenic diet for epilepsy. We worked with that a little bit. I don't think I've ever seen anything about ketones in Alzheimer's disease.
And then Rangel is asking if there's any studies about coconut oil.
I have seen no studies about coconut oil, but and I don't see, as far as what's in coconut oil, something that someone will jump right up and put a lot of money into a big study on it, would be my guess. But all these things, trying to think of even the exact makeup of coconut oil, but I think most of the data is just on omega-3s and basically trying to make sure you have the best amount of omega-3s and limit your omega-6s. But I don't think there's really good evidence on individual things.
How about turmeric or other spices?
Now, turmeric is a real interesting thing, because turmeric has some it's curcumins in it. And if you give turmeric and you measure blood levels of the curcumins, it's not bioavailable, which means it's not absorbed. So I think, again, you've got a lot of wonderful in vitro studies with cell cultures and all that kind of stuff, showing anti-inflammatory and all that kind of stuff. But until they come up with a bioavailable form, there's no way they'll be able to get any positive effects with curcumin.
Well, Seward is typing, but I don't know if that's going to be a big question. So I'll ask in the room again if there's any additional questions.
You hear about all these things along the line of the coconut oil. Blueberries, dark chocolate, and dark chocolate, I think some people are inclined to think that that's going to help them, so that gives them an excuse to eat it.
And a glass of wine.
And a glass of wine, yeah. And so those are somewhat natural substances, I guess. And so are there, I don't know if there are a lot of formal studies about those things, but are there any even just sort of anecdotal effects of any of those things, positive effects of any of those things?
Well, the whole, the eating a lot of blueberries and all that kind of stuff, there's never been enough controlled study to really say, what works and doesn't work. I am a firm believer that for most of these, it's what you're not doing as much as what you're doing. I'm a big fan of doing things in moderation. Your one glass of wine every night, not 3, and your one thing of chocolate every night. So, a lot of, that's the thing with turmeric. If someone would come to me and say, yeah, turmeric has really helped me with irritable bowel disease, I would think that would be worth investigating, because you've got definitely a local effect, and similarly with antioxidants. So by the time you digest these things and get them into the bloodstream, and it's kind of harder to really envision some of these having big effects. I mean, they used to think cranberry juice worked by acidifying the urine, and until someone finally did the study and showed that it doesn't acidify the urine, because your body's pretty dang good at keeping the urine pH where it wants it to be. So,
is there also a possibility that everybody's body is different, and some bodies might react a little bit in one direction to something, and other bodies wouldn't react that way, and so this makes it almost impossible to really figure out anything.
The question was on intersubject variability, and I totally agree, and I do think that's why all these studies need to start looking at baseline. Who are these people at baseline? We're adding things, and we're adding natural things, and not looking at what people are at baseline. It makes sense that you may not be able to see an effect. Because you may be missing that 10% of the population that would really, really benefit by something. And I think that was, when they identified ApoE4 with Alzheimer's. I wish I could remember the drug, but there was one drug they were looking at, and companies weren't really wild about just marketing towards one patient population. But there was one, and I think it was a PARP. Shoot, I wish I could remember the name of the drug. But anyway, it was a study where if you look at the whole population, it didn't show any effect of it all in cognitive decline in Alzheimer's. But when you just looked at just the ApoE4s, it did. So, and the companies just weren't really excited about that. I mean, it's hard enough to get the companies to come up with sex-dependent dosing on a label. I mean, this is versus genetic dosing. And that may be where they're coming from. I'm a big fan of individualizing and personalized medicine, so. But it's a good point.
Are there any studies about Alzheimer's and marijuana?
Yeah. Well, I work in epilepsy, and a lot of studies on cannabidiol and marijuana. But with Alzheimer's, I'm just trying to think. I would really doubt there would be studies. Well, number one, it's hard to do studies, obviously, on marijuana anyway. And the confounder of something having cognitive dysfunction already, and then giving them marijuana would have been a problem. I think with cannabidiol is the non-psychotropic portion of marijuana that is being studied. In fact, there's a company that has phase 3 trials in epilepsy with cannabidiol because it has no psychogenic properties. So you don't mind giving. That's what Charlotte's Web in Colorado is about. It's a version of marijuana that has a high amount of cannabidiol and very little THC. And so, and those studies are looking positive. In both Dravet syndrome and now Lennox-Gastaut, they're showing a decrease in incidence of seizures. So, it's if you look at something like cannabidiol and put it on a cognitive brain that has mild cognition problems, that might be different than THC.
And I appreciate you telling me how to pronounce that. I always thought it was cannabinol.
It just might be.
So another question is the typical American diet and the effects it may have on dementia.
The question is American diet and what it has on dementia. I have no idea. I think that's what the studies with the fish we're trying to get at, as far as just another reason to increase your intake of fish and decrease your intake of other things. So I don't know how else to answer that.
Then I think that's all the questions, unless there's others here.
Mm-hmm.
Yeah.
And we have three questions on slide 25. It seems like the 5% to lower risk of the dementia and 7% to lower risk of the Alzheimer. It seems like the fish oil is more effective in Alzheimer and the other type of the dementia. So I wonder how they define the dementia, because there are a lot of type of the dementia. So did you get?
I think the question was on slide 22. Is that the one with the fish intake and then the divided up to the DHA?
25. So because depending on type of dementia, they have the different cause of the dementia.
Oh, sure,
so,
yeah. The question is, do I know how they define dementia? No, I do not remember exactly how, but I can send you the article. Actually, I've given you the reference here too. I actually don't know off the top of my head.
And 0.1 gram per day is how much equal to the amount of the real fish?
So the 0.1 gram per day, how much is that in the fish? Depends on the kind of fish. So what they did was they looked at, are they eating salmon, are they eating mackerel,